So how's your practice going on?
Ma'am, just started only.
Yeah, it's just going on. Hmm?
Yes, ma'am.
Good. Okay. All right. So, guys, few people have joined today. Okay, will join in the time. So, I have already shared the two topics, speaking topics of today's in the group. These are the next two topics. Okay, so, one is the topic number 32 and 33. So, you have anybody from you who has an exam on 10th?
Yes, ma'am.
Anu, yeah? Anu, so you have 2 minutes exactly for task number 32.
Okay, ma'am.
Okay, Anu, you can unmute yourself and can start.
Okay, ma'am. Good morning.
Morning.
Hello, ma'am, can you hear me?
Yes, I can hear.
Okay. Good morning.
Morning.
I am Anu. I am the nurse in charge of this nursing home. How can I help you?
Um, basically, I'm here. My name is John, and I've just visited my father. So I have the few concerns regarding his condition.
Okay. How can I address you?
I said my name is John.
Okay, Mr. John. I understand being a son, you have many concerns. Could you please tell me what is bothering you?
Well, yes. The first of all, I would like to ask about this nasal tube. When I saw him, he was quite irritated with that. He was pulling it up. Maybe, this is giving him a tough time. So, do we have some other alternative for that?
You know, Mr. John, Nothing to worry about it. I can understand your concern. I am very sorry to tell you that there is no other alternatives for this nasal tube feeding. You know, because of the stroke, your father's muscles is paralyzed. Okay, so
Mm-hmm.
this tube will help him to give adequate nutritional requirements for him. This tube we inserted from nose to stomach. Okay, and
Mm-hmm.
this tube feeding help him to prevent aspiration when we feed him. That
Mm-hmm.
clear, John?
Mm-hmm. Okay.
Okay. Do you have any other concern?
Yes. The another is, I noticed that he was lifted up by some weighing, some machines. So I don't know if it is safe to use.
Okay. Uh, John, this machine is quite safe. It will improve the blood circulation. Okay. And it's very easy to transfer him from bed to chair. And we can use this machine to transfer him for the shower also. He will not get much hurt. Okay.
Mm-hmm.
This is a,
Mm-hmm.
and nothing to worry about this. Okay.
Mm-hmm. Okay. And concern of his privacy.
Uh, okay, John, I can understand that. We have curtains, the rooms. So whenever we are doing some procedures, we uh, we use these curtains, uh, and we will close the door also. Okay, so
Mm-hmm.
no need to
Mm-hmm.
worry about your father's privacy. Are you
Okay.
clear that?
Okay. All right.
Okay, John. Once again, I assure you that no need to worry about anything. We are giving good care to your father. Okay, we have
Sure.
hospital policy to maintain privacy also. So everything we are giving in a proper way. So
Mm-hmm.
don't worry about anything. Okay, Mr.
Okay.
John.
Yeah, that's fine.
Okay, John. I hope I have cleared all your doubts. Am I?
Yeah. Yes. Thank you.
Okay. Okay, John. Thank you.
Okay, I know that was good, but be little energetics when you speak.
Okay. I think
Okay.
somewhere close also.
Okay. All right. Somebody joined as a guest. May I know the name?
Chinnuma. Good morning,
Yes,
ma'am.
Chino, you can start now.
Okay, ma'am, 1 minute. Good morning.
Morning.
Uh, Please take your seat.
Okay.
I'm Chinnamal Babu, one of the registered nurses working in this hospital day procedure center. How may I address you?
You can call me Tina.
Okay, Tina. You looked so nervous. What happens to you?
Um, Not really. Actually, I was here to meet my father, and I noticed that he had some trouble with the nasal tube. So I just want to know that if does we have any other replacement for that?
Okay, I can understand your concern. And your father is uh, have stroke, and so we need to follow this nasogastric tube feeding. Okay, so if we are continuing with the oral, um,
Hmm.
I'm sorry, ma'am, because I am prepared 31 first.
No problem. You prepared this. You have 2 minutes. In the meantime, I'll take somebody else.
Okay, ma'am.
Anjali,
Yes, ma'am.
yeah, you can start.
Good morning.
Morning.
My name is Anjali, and I am the charge nurse in this nursing home. Uh, how can I help you, sir, today?
Uh, you can call, basically, my name is John, and I'm here to visit my father. And
Okay.
I had few concerns regarding him. If can I discuss that?
Yes, of course.
Okay. So the nasal tube which he have, I found that he's quite irritated with that. So I was wondering if we could have some other alternative.
Okay, John. All right. I really understand your concern about your father, and I assure you that your father is getting a best care from this facility. And regarding the tube feeding, this is a nasogastric tube, and we are inserted from the nose to the stomach. Are you getting my point, John?
Okay, all right.
And as you know, your father has had a stroke, and now he is unable to swallow food and medicine. That's why we are inserted this tube, and we are giving food and medicines like medicine from the form of liquids. But
Mhm.
at this time, we are not trying to give any food or medicine into the mouth. If we are giving food, your father will aspirate and it will leads more complication. Okay,
Mhm.
Josh.
Oh,
Uh,
all right.
and in order to meet your father's nutritional status, that's why we are giving food through this tube.
Okay. Mm-hmm.
Okay. And do you have any more concern, John?
Yes, actually, I noticed that he was lifted up by some machine. So just wondering if it is safe to use.
Okay, yeah, it's a specialized machine that we are used to lift a bedridden patient from chair to bed, and we are taking your father to shower like that. Okay, and don't worry about this machine. It's a specialized machine, and for using this machine also your father's blood circulation will increase, and it will reduce the chance for getting blood pressure ulcers. Okay,
Hmm.
John. So
Okay.
don't worry
And I hope
about
his
this.
privacy is maintained.
Okay, I can understand your concern, but don't worry about that one. We are providing curtains and curtains like for better privacy, and don't worry about that one, John. Okay?
Okay.
Usually
All
we are
right.
use curtains for giving care and everything. Okay.
Okay. All right. Thank you.
Okay, John. Have any more concern about this your patient
No.
condition? Thank you, John.
Oh, I guess it's clear to me. Yes.
Thank you, John.
Thank you. Okay. So, Chinu, you can start now.
Okay, ma'am. Good morning.
Morning.
I'm Chinnimal Babu, one of the registered nurses working in this nursing home. Please take your seat.
Mm-hmm. Mm-hmm.
How may I address you?
You can call me John.
Okay, John. What brings you here today?
Oh, well, basically, I met my father just now as he's admitted here. And I noticed that he had some concerns, which I would like to discuss now. Is that okay?
Of course.
Okay.
Uh,
So the first is that I found that he was very uncomfortable with the nasal tube. So, is there any other alternative for that?
okay, I can understand your concern regarding your father. And Mr. John, and I can assure you that we are giving the best practices and the best treatment to your father, okay? And as you know already, your father has had a stroke. Am I right?
Yeah.
So, and we need to give him for his nutrition requirements. We need to start by NG2 feeding only, because if we are giving through the oral feedings, he will get some choking problems. Okay, and
Mm-hmm.
I can tell you that your father in a recovery period, and once your father is okay, he can eat through the mouth, and we can remove this NG tube, okay, and after that we can start through oral. Is it okay for you? Hello, ma'am.
Okay.
So now we need to continue
Yes, it's
through this
okay.
NG tube, okay.
All right. And what about this lifting machines? As I noticed, so is it safe to use?
Of course, it's safe to use because and your father has now some limited mobility, and we need to give some mobility also for your father's recovery, and uh, it will help more improve the blood circulation also. And also this lifting machine we can use when the father is transferred to bed to chair, and while transferred to shower, okay. So it will helps more. It's quite safe for your father. I'm
Mhm.
clear.
Yeah, that's clear. And I hope his privacy is maintained.
Of course, and we are here to provide all our patients. We are providing the privacy, and when we are doing any procedure or anything, we are drawn our curtains, and we are shut up this close these doors also. So we are giving all privacy to our patients. Don't worry for that, Mr. John. Do you have any other concern regarding your father?
No, I guess that's clear. Thank you so much for your clarifications.
Okay, thank you. And I can assure you that your father in a recovery period, and he will be recover soon. Okay. Don't worry.
All right.
Thank you.
Mhm.
Okay.
Okay. All right. That was good. Yes, Jules.
Hello, am I audible to you?
Yes, yes.
Ah, fine. Good morning. Uh,
Yeah.
Hello.
Yeah.
I'm
Good
I'm the
morning.
nursing. Good morning. I'm the nursing in charge of this hospice. So
Mhm.
may I know whom I am talking to you?
Oh, yes. My name is John, and I was here to meet my father. I just met him. Um, and I have few concerns regarding him. If you won't mind, can I discuss now?
Okay, you can share your concerns with me.
Okay. So, first is that I noticed that he wasn't that comfortable with the nasal tube. I think it's quite uncomfortable for him. So, do we have some any other alternative for that?
Okay, Mister. You might have noticed a tube that is placed through his nose, and it is directly going to his stomach. And this is a tentative tube that is placed in order to give food and nutrition for your father. So this cannot be removed because it is imperative uh, at present for him. Uh, Apart from that, this is not going to do any harm for him. You must also understand about you must know that this is not going to do any harm for him. Uh, Apart from that, he is in the safe hands, and the place he is continuously being monitored, and we are providing uh, medication and food on time. So you need not worry about that too, uh, and about this nursing home. Uh, uh,
Okay.
okay,
And
I think you are clear. You're all.
yeah, that one is clear. So, secondly, I noticed that he was lifted up by some machines. Is it safe to use?
Of course, this is a machine that is used in order to ambulate or mobilize the bedridden patients. This is a well-equipped machine, and this machine also reduces the chance of getting pressure sore. Uh,
Mm-hmm.
this can be used for your father. So, as your father is a stroke patient, and he cannot do his daily activities his own, this lifting machine is much beneficial for him. So there is nothing to panic about that. Is the
Hmm.
I think you are fully convinced with my answers.
Yeah, that's okay. And I hope its privacy is maintained.
Okay, great. The privacy is our concerns, and we understand that, and we take all the necessary step in order to provide privacy for our clients. The first thing we are use side curtains for the patients, and will make sure that each patient is getting their own privacy. So you need not worry about that also. Uh, Apart from that, we will make sure that because each patient is having their own privacy issues, so we are always concerned about that. So I think that part of your concern is also clear. Uh,
Yeah.
is it okay? Do you have any
Yeah.
more concerns that is
No,
left?
no, I guess that's clear to me. Thank you so much.
Okay, thank you.
Okay, that was good, Jules.
Thank you, ma'am.
Okay, yes, Kulvinder.
Hello, good morning.
Morning.
My name is Kulvinder Kaur. I am one of the listeners that's working in this nursing home. How may I address you?
Okay, John.
Okay, John. It seems you are looking some worry. What is bothering you?
Well, I just met my father, and I have few concerns regarding his condition.
Okay, John. I can really understand your concern. As you know, your father has a stroke, so uh, and uh, your father has a stroke, so
Mhm,
um, don't worry, he is in a safe hand, and we will
mhm,
provide the all things that would be possible. Would be possible for his faster recovery. So before now, I
mhm.
have another concern.
Yes, as I said, the first is this: he's not that comfortable with nasal tube. So, do we have some other alternative for that?
Oh, I can understand your concern, George, but I would like to explain. The nasogastric tube is very safe for his. He has got he has get he has he has a stroke, so his muscle so he doesn't able to eat something by mouth. So nasogastric tube is very important for his to maintain. Nutritional requirement as well as it will also prevent the choking and we are providing the all medications and other essential nutritionals by the feeding tube. Is that okay?
Mhm. Okay, all right. And what about the machines? I noticed that he was lifted up by them. Is it
Oh, I
safe?
really understand. Okay. I really understand your fear, Mr. George, but I assure you it is very safe for your father because your father doesn't able to walk, so it is very safe. It is very safe for his, and moreover, it's improved the blood circulation, and we can transfer easy his from bed to chair and. Can take transfer to for shower with this machine. So I reassure you, don't
Oh,
worry about that. Do you have any other
okay.
concern?
And yes, I'm concerned about his privacy.
Oh, I can understand, Mr. George. So privacy is very. We will maintain the all privacy when we give the all procedure. So curtain and drawer. we will draw our curtains and shut the door when we start the any procedure with your father. Is that okay for you?
Okay, that's fine.
Do you have any other concern, Mr. George?
No, I guess it's all clear. Thank you so much.
Okay, thank you for answering, Mr. George, and I wish for a speedy recovery for your father.
Okay, all right. Thank you. That was good, Kulvinder. How are you? Otherwise, are you okay now?
Yes, I got yesterday ultrasound, and the doctor said endometritis classification and some cyst around the cervix.
Okay. So take care, okay?
Yes. Okay, well,
Okay.
right.
All right. Um, yes, Lissy.
Yes, ma'am. Good morning.
Good morning.
Good morning.
Good morning.
I'm Lissy Patterson. I'm the nurse in charge of this nursing home. How can I help you today?
Oh, actually, my name is John, and I just visited my father. And I have few concerns regarding his condition, and I would like to discuss that with you. Is that okay?
Sure. But before, could you please tell me about your father's name?
Yes. His name is John Keane.
Okay. Now I understood. He's here for the care after the diagnosis
Yeah.
of stroke. Is that right?
Yes. Yes. So I just met him, and I noticed that he wasn't that comfortable with the nasal tube. So I was wondering if there was any other alternative for that.
Yeah, I totally understand your concern. But are you aware about your father's condition?
Yes.
So at present, this is the best treatment for your father because this tube will help your father to meet the nutritional status as well as it will help to um, uh, it will help to prevent the choking of the food.
Mm-hmm.
Because as you know that one side of your father's body is not fit, move over. So if you are
Mm-hmm.
giving by mouth, there is the chance of choking. In order to avoid this, we have to continue this tube feeding. After gradually your father's condition is stable, we can provide some oral feeds. If he tolerated, we can remove this one. Are you able to
Okay.
understand?
Yes.
Do you have any other concern?
Yes, noticed that he was lifted up by some machine. So I just want to know that is it safe to use?
Yeah, of course, your concern is valuable. And I can explain to you about this lifting machine. We are using this lifting machine in a long period of time. So it's
Mm-hmm.
quite safe and easier for us and as well as the patient. And it will also help to improve the blood circulation as well as moreover, we can transfer the patient from bed to chair and we can easily accessible for make the patient to get the shower also. So it's quite safe for your father and no need to worry about this machine. Okay. Hello. 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 Hello, ma. Hello, ma. Can you hear me? Hello.